Hello, everyone. Dr. Andre Jones here with Spire Dental. So I just filmed a video answering a question about different levels of sedation in dentistry. And so a question I often get asked is oral sedation safer than general anesthesia? So going as a quick refresher, oral sedation is where we're taking a pill in order to become sedated. Depending on how many pills that we take or the type of combination of pills that we take, we either are in a state of feeling just relaxed or we're completely asleep. And now general anesthesia is where we are putting someone fully asleep. And that's usually done either through a gas and also through an IV at some point, or it could be just straight through an IV, depending on what the person allows. So the question being asked is one safer than the other? And each of them have their own degrees of risks. With oral sedation, yes, you're taking medication to help you be sedated, and the purpose of that level of sedation is not to make you as deeply sedated. It's just to put you in either to a place of comfort or a light sleep. Whereas general anesthesia, you're going to be fully sedated. You have a machine that's, you're intubated, have a machine that's helping you breathe. So those are different. There's different risks involved with that. But as far as the level of safety is, oral sedation, since it is through a pill form, if you do become overly sedated, there's not really a way that we can get you to wake up quickly. When you take a medication by the mouth, it usually takes 30 minutes to an hour to feel the effects of it. Whereas in an IV, you feel the effects of it within 10 seconds. If you get overly sedated with oral sedation, well, how are you going to wake them up? You either have to give them a shot to wake them up, which still takes about 5 minutes to kick in, or we'd have to urgently start an IV and now administer them medication to wake up if they got overly sedated. Whereas like in general anesthesia, like I mentioned, this person is, although they are at a deeper level, they have to be intubated, they have machines helping them breathe, there already is an IV that's inserted in them. And so because that IV is already there, if someone gets too sleepy, we can just give them medication to wake them up much quicker. So they have their different risks associated with them. As far as level of safety, again, it really comes down to the expertise and level of the provider and the planning and the screening. So in my practice, we do a series of ways that we screen people to figure out what are their risks, and that helps us choose, well, which form of sedation is going to be the safest form of sedation for them. Because, yeah, oral sedation there's less risks involved, but if something goes wrong, the way we have to respond to it can be a little bit more difficult than if we are responding to someone who is at a higher risk general anesthesia, but we already have access the way we do. So the best thing you could do is to come into our practice and help us evaluate what level will be best for you. And we have a custom process in which we approach each individual, and we customize our approach to sedation based on what will be best for you, best for what risks you have. We educate you on what the risks are, so you can also then make the best decision for yourself. And our goal and purpose is to empower you through education and making you informed and helping you choose which form is best for you, but also empowering you by when we do choose or you choose what level is best for you in order to get your care done. And so that's what we're here for. A question I get asked is, what sedation level is recommended for oral surgery? So it really comes down to what type of oral surgery procedure is being completed. Oral surgery is such a broad spectrum. That could be a simple loose tooth all the way to a full-on jaw reconstruction. So the way that we decide is really has to do with, one, what level of surgery are we doing? Two, what is the person's comfort level that we are wanting to achieve? And then also, what have they determined for themselves, what level that they want to be at for comfort? And so I would say in most scenarios, the level 3 or moderate sedation that I spoke about in one of my previous questions is the level that's most commonly achieved or recommended for oral surgery. And so level 3 is where you're going to be in a state of total relaxation to the point where you are either in a light sleep or in a good, comfortable sleep. Oftentimes this is called twilight. So you're able to be stimulated to be woken up. So if I tap on your arm or call out your name, you might, in a groggy state, kind of respond to it. And what's nice with that is because, depending on the procedure we're doing, you might have to open up a little wider. You might have to turn your head right or left, and you're able to help us through that stage and through those things. But the great part about it is that even if you're able to be woken up, medications we use kind of wipe our memory. And so you have no memory of it. And that way you're able to be just calmly taken through a procedure, and you're able to help us through the process, but not remember any of the bad parts of it. And what I find too is when someone is able to be sedated through something that would generally be uncomfortable, it actually makes their recovery outcome much better because you're entering out of it in a more calm state. And we're also able to give you medications through an IV, which would also help in the early stages of your healing and comfort. Another great question I get asked is, do you need sedation for a tooth extraction? And the question is, no, not necessarily. So there's different types of it. So when we say anesthesia could be referring to the local anesthetic we use to numb somebody, or it could also be referring to sedation. We need sedation as far as local anesthetic to the area that we're going to be taking out the tooth. That is an absolute must. We want you to be comfortable, and no matter how strong someone is, we don't want to put someone through the challenge of sitting through having a tooth out. Depending on the degree of difficulty or the degree of what we need to do in order to get a tooth out is where we will often recommend someone be asleep for the process. And because our goal, or my goal in my practice, is to make each and every person as comfortable as they can be as they go through the treatment that they need to get them healthy. And so we do find that being asleep is a way to make someone more comfortable through a tooth extraction. But like I said, it's not always a must, but it is something that definitely will help facilitate someone's comfort to a higher degree through that procedure. Thank you for tuning in. I hope I've been able to answer some questions and kind of just give some more knowledge on what's available in dentistry today as far as comfort options. I hope it was informative for you to see that dentistry is not something that you have to endure or bear through or just tolerate the process, but that we really can facilitate it in a way where it is comfortable and even enjoyable. You as an individual don't have to fear or put off really what you need to get healthy. And so if you would like to find out more information regarding what comfort options we offer, sedation dentistry, please give us a call at 210-734-5092. Look forward to hearing from you.